Cannabis has spent 18 months convincing state and federal health authorities to give the green light to a pioneering clinical trial. In a world first, researchers at the University of Western Australia are about to test whether a cannabis medicine can treat insomnia.
We see insomnia as a market or a condition that we have a high degree of confidence that will respond to cannabis therapy. It's a big market in its own right. I think 1 in 6 people suffer from some kind of sleep disorder, and insomnia is one part of that fraction. The anecdotal evidence is certainly out there that people feel as though they relax and can go to sleep using cannabis.
This one measures airflow through your nose and mouth.
24 volunteers will be given cannabis for 2 weeks and a placebo for another fortnight.
Okay, Debbie.
Finished product.
You can stand up.
Okay. Oh.
Oops. Yep.
Their sleep will be measured both in the lab and at home. When advertising for participants, researchers didn't mention they would be taking cannabis, only revealing it after they volunteered.
None of them have said, oh no, I don't want to be involved. They might have been a little bit surprised, but they're not against using medicinal cannabis to treat their insomnia.
Was that at all surprising to you?
Yeah, I thought that there might be a few people that would say, oh no, I can't use that, I'm not interested. But we haven't experienced that. Okay, Debbie, I'm going to get you to lay there with your eyes closed.
Okay.
One problem with cannabis being illegal for so long is the lack of hard data about its medicinal effects. As more countries legalise its use, clinical trials like this are starting to become more common.
That's great. Now staring at a spot on the ceiling again.
Cannabis company is also running a trial in Chile for autism, and in Spain it's researching treatment for breast cancer. Despite the money pouring into the cannabis industry, patients are still struggling to access the drug. Since legalisation in Australia in 2016, medicinal cannabis has only been prescribed to about 600 patients. Experts mostly blame complex state and federal rules.
The regulatory system is a complete basket case here in Australia. Each and every state has a different regulatory framework in place. There's the federal, TGA that also has a say. So even if the GP feels that medicinal cannabis is the appropriate treatment for a patient, it's very, very difficult to access it. So there are huge barriers that need to be overcome before patients actually have access to medicinal cannabis here in Australia.
Those barriers are forcing people like Jen and thousands like her to seek their own supplies outside the law. Every month, Jen drives from her Gold Coast home across the New South Wales border to buy medicinal cannabis on the black market. Jen is dying from mesothelioma, cancer caused by asbestos exposure.
There's 4 products and they have specific uses.
She spends $700 a month on medicine she says helps relieve pain and nausea.
And this is the strongest one. And this is
Jen's oncologist can only prescribe her medicinal cannabis after securing permission from both federal and Queensland health authorities. That takes time she doesn't have.
I understand it's a process that takes between 7 to 10 months, which actually, if you're a standard mesothelioma patient on a normal late diagnosis, you're gone. You don't live normally that long, unfortunately, and that's the sad truth.
How would you describe the current system?
Inefficient, Byzantine, and, to be honest, quite obstructive. If you look at what's been happening over the last 18 months, where people have got frustrated, is there has been a lot of political currency put out there in terms of we are going to provide access and bring materials in, but that's not translated into the reality.
Reefer madness is over. This crazy country, this Mad Hatter place called Canada is doing it. And I think it couldn't be a better place to launch it because, you know, we are relatively well-mannered, pretty boring. We like structure. Our governments are going to be selling it. So when you come to Canada next summer, maybe about September, you're going to line up at a store run by the state or provincial government. All the employees and most of them will work for the government. And they'll be selling products that have been described and defined by the federal government. And all you need to have is the money and your ID to say that you're over 19. That sanctions and validates a whole bunch of things that I think is going to catch the globe and say, wow.